Okay, so we're looking at last video representing the skeletal system as far as going over what you need to know. Here we have, we'll start from superior, we're looking at the hyoid bone. We have the lesser cornu and the greater cornu. Greater cornu in the posterior, lesser cornu in the anterior, hyoid bone. Okay? Then we have the clavicle, clavicles, sternal end, acromial end. This is the acromion process of the scapula, so the acromioclavicular joint right there. We have the sternum, we have the manubrium, the body, the xiphoid process of the sternum. We have hyaline cartilage here, which would be the costal cartilage, which helps to articulate the ribs to the sternum. Okay? We have 12 pairs of ribs. We have the first 7 pairs, 1, 2, 3, 4, 5, 6, and 7. First 7 pairs are considered the true ribs. 8, 9, and 10 pairs are considered the false ribs, and then 11 and 12 pair are considered the floating ribs. Also, as we're looking here on your model, we have the vertebral bodies that we're viewing of the spine, okay, and the vertebral discs, intervertebral disc. So if this is L5 vertebra, this would be the L5 disc. L4 vertebra, the L4 disc. Okay. Let's bring our model around here. Okay. So again, 12 pairs of ribs. We have, and they all articulate with the 12 thoracic vertebrae. So 1, 2, 3, 4, 5, 6, 7. C1 through C7 right, would be the cervical vertebra. T1 to T12 would be the thoracic vertebra. L1, 2, 3, 4, and 5 lumbar vertebra. Also, we're viewing this, if you can see this bend in the rib, that is the angle of the rib, right in through here. We have the spinous processes that you're viewing in the central portion of the spine. We have transverse processes here. And on the lateral view of the lumbar spine, we can actually view the intervertebral disc, intervertebral foramen, the IVS, where we will have the spinal nerve roots exit off of the spine. C1, also known as atlas. C2, also known as the as axis. Okay. Look over here. We can see C1 and C2 articulation. Here you're viewing the superior articulating surfaces that will articulate with occiput, inferior articular surfaces. We have the transverse processes. This is the vertebral foramen. Now C2 has a structure on it called the dens, which is right here, that enters up and articulates with C1, right there. Okay. If we look at a thoracic vertebra, here we're seeing the vertebral foramen where the spinal cord would be traveling through. Here we have the body, the vertebral body. We have the superior and inferior articular facets. Okay. We have the transverse processes and the spinous process.